Andrea, are you on?
Yes, I'm on. Can you hear me?
Yep, we can. And then Greg is here. I'm not sure. Oh, there's Morgan. Wait.
I'm here. Hi, everyone.
Okay, good. All right, so we do have a quorum. I believe Jose is not Jose. What am I saying? Jorge is he on the board anymore? Or is he just off this month and then he's off next month?
Yeah, Greg, this is Camille. My information from Rita and from the administration office is that his term goes through August. So
okay.
I'll make some more announcements about that, but
Okay.
It ends in August. Yeah.
Okay. All right. Well, we do have a quorum, and let's see. I don't think Brooke said she could make it, so that's why we wanted to verify that we had a quorum. So we will move forward. Good evening, everyone. It's 5:32. This calls to order the regular meeting of the Boulder County Board of Health on Monday, July 12th, 2021. We are holding this meeting telephonically still due to the COVID-19 pandemic. And we'll likely probably look to maybe take a change of pace here starting in August, but probably still providing remote options for public and or folks who are just contributing to parts of these meetings and don't have to be there in person. So I'm sure there will be more instructions, more direction on that as we move forward. Welcome. We will go ahead and kick off the agenda, which item 1 is public comments on unscheduled agenda items. Are there any public comments on unscheduled items?
Hey, Greg, I do have some comments. I'm not sure if it's more appropriate now or it's in reference to the mask policy in elementary schools. I'm not sure if it's appropriate now to talk about that or during the pandemic update section.
I think it's probably okay to talk about now. That really is that part of any of our updates, Camille or Lexi? Yeah, okay. Sam, do you mind holding on till that part of it?
Sure, yep.
Okay, if you can do that, great, thank you. All right, is there any other public comment? Okay. Without further ado, then, we will move on to item 2, approval of the June 14th, 2021 regular meeting minutes.
This is Morgan. I move to approve.
This is Landry, a second.
Okay, motion and second. All in favor? Aye?
Aye.
Aye.
Okay, motion carries. Now, item 3, approval of resolution 2021-01, adopting 2022 recommended budget.
This is Landry. I move to approve.
Do we need any discussion on this one, Camille? This is
Greg?
really, it just adds on to what we did for the study session in June.
Absolutely. I was going to say the same. We've had a lengthy discussion. To my knowledge, there weren't any lingering, or at least I didn't have any board members reach out to me about any other questions. So I don't think any discussion is necessary unless the board feels it so.
I just have a quick question about the sustainability tax. I know that we've got a request in to the sustainability tax from the county, right, to cover some of our costs. What's the total amount that's expected to come in from the sustainability tax?
And that is in the document I sent. It's 600 and something. Hold on, let me get it for you real quick.
That's the total we're requesting, right? Do you know what the total is, Marielle, and that the sustainability tax itself is anticipating to bring in?
$676,955.
Sorry, I'm just pulling up the document, so I've got it in front of me. Is that what we're requesting, right?
Yes, that's what we're requesting, and it's actually an increase from last year. Last year was 560, I believe. And we are increasing it because of other program needs, like I think it's mostly like the food vouchers, fruit and veggies. So that is part of the increase from last year.
Sure. Sure, I get that. Thank you. And I saw it. I think that was really clear in the document. I just didn't know if you knew what the sustainability tax itself is bringing in for the county, like total revenue anticipated from that tax. So how
That-
much is, like, what percentage is the 694 or whatever we're asking for out of the total that it's bringing in?
I don't have that information, but I can reach out to see if the county has a good estimate for 2022, and I could either
Yeah.
send the email or provide an update on next Board of Health meeting, if that's
Ye-
okay.
Yeah, that's great. No rush on it. I was just curious kind of what the total tax was anticipated to bring in, and then, how that is going to be spent in the county. I know we shifted some folks from public health over to the new office of,
Oscar.
yes, thank you, Oscar. All right, thanks. That was my only question.
Okay. Landry, do you want to remake your motion?
Sorry, it takes me a second to get to the mute button. I move to approve the budget, the 2021 budget. It's the 2021 budget, right?
It's, do you have the agenda in front of you?
No, I can pull it up.
Okay.
I do have it in
It's
front of you,
just,
Morgan.
usually the way we do that is we approve it based on
can-
what it is in the.
I can do the motion. This is
Okay.
Morgan. I move to approve resolution 2021-01, approval of the 2022 recommended budget submission.
Okay, thank you, Morgan.
A second.
Okay, motion and a second. All in favor? Aye.
Aye.
Okay, the motion carries. And item 4, emerging recovery priorities for BCPH.
Thank you, Greg. And I think, Lexi, is that your presentation? Do forgive me. Yes. But before we start though, Greg, do you mind if I let everyone know, staff that are in the meeting today? Is that okay, sir?
Yeah, no, that's fine. And I usually start with that, but skipped it. So yes, please introduce the staff.
No worries. I think I'm gonna skip over their titles at the risk of botching them because I am getting to know everyone, by the way. This is my moment to say I've been joining team meeting after team meeting and really getting to know staff. But we have Mariel Baron with us, Chris Campbell, Indira Gujral, making sure I've got everybody. Kate Haywood is in the virtual room. Kelly Hinch, and then Rita Mangan. She is now taking Tammy's place in keeping us going and getting our agenda together. Of course, Lexi Nolan, you see her. Trina Ruland, excuse me, Trina. And then I want to make sure, Angela Cimental, our communications person, and Dr. Urbina is on the phone. He always says I'm not supposed to call him doctor, so Chris is on the phone. If I've missed anyone, can you please speak up?
Sure, Daphne.
Daphne, you are right in front of me, Daphne. I apologize. I skipped
No
right
problem.
over you, and I'm looking right at you. And did I forget anybody else?
Hi, and I'm Mary Faltinsky. I'm here representing Community Health tonight.
Thank you, Mary. I'm sorry I missed you too. You've all been, I didn't ask for your grace before I did introductions. I'll get better at this as each month goes by. But thank you, Greg, for that moment. And Kate Haywood is an attorney for the board. Excellent. Thank you. Thank you. I'll be quiet now. Lexi, it's over to you to give us our emerging recovery priorities presentation. Thank you.
Thank you very much. Lexi Nolan, Deputy Director of Boulder County Public Health. Good evening, everyone. I am working especially remotely this evening, so I'm working from one monitor, which is a new experience for me. So please let me know if I am putting something in front of you that says BCPH Emerging Priorities for Recovery. Is that what you're seeing? Great. Okay.
Got it, Lexi.
Yes,
So-
Lexi.
Thank you, everyone. Good evening, board. We are going to talk with you just a few minutes this evening about what we're starting to see as some of the critical recovery priorities. And this presentation is in line with the development that we've been working on over the past few months of beginning to shift from response to recovery and really taking stock of where the community is, where we're seeing needs, and what the implications are for our work in BCPH. Just reminder as we get started that there are multiple planning processes going on right now, and no one faults you if you are getting confused about all of the different streams of conversation. We have presented to you in the last couple months our BCPH Pandemic Response Recovery Plan, which is really about how we begin to bring the pandemic response back into our agency structure. So that it's not an emergency structure, it's not separate from our agency or our business structure. It is our ongoing response is incorporated into the public health structure. That work is largely implemented. We have a good start on it, and we'll continue to have adaptations over the next year as needed. What I'm going to talk to you tonight about is the BCPH Community Recovery Plan, which is really about how we begin to build a public health specific plan to address the community health impact of the pandemic. We really expect this process to start now over the next couple of months and go on through the spring of 2022. This work will also tie into Boulder County Public Health's strategic plan refresh next year. We will be producing a new strategic plan by the end of 2022 is our expectation, and this will feed into that. And we do expect that this work has a multi-year trajectory. This is not work necessarily that will happen overnight, but we wanted to begin to introduce you to what we're thinking about and seeing in the spirit of collaborative work and ongoing conversations that also link to number 3, other recovery plans that are happening alongside this work, including the county's community engaged planning process, the county long-term recovery planning, both of which are being led by the commissioners, as well as the pro boco shorter term focus work on recovery, and conversations with the agency administrators in that monthly meeting and other groups. So lots going on here, but this is really kind of public health's response to the community. So in terms of what we're seeing and learning, what we are seeing has happened and continues to happen really centers around family economic insecurity, social structures that have become fractured and increasingly frayed, child, youth, and family impacts in particular, mental and behavioral health impacts and trauma, and disproportionate impact on priority populations. And when we think about why it's happening, the analysis really reveals, that we have some, I think I can get rid of, there we go. Why it's happening, we have some insufficient protective factors and resilience in our community. This is really just about how do we make sure that our community is integral and strong, and is able to withstand, what we hope are small hits, but sometimes are large impacts. This is also a consequence of the fact that this pandemic really created some unprecedented needs, some unintended consequences. We saw that a lot with schools and closing of schools, and some of the emerging science and data on risks that show that we really we weren't ready for a pandemic, right? This is about preparation. This is about emergency planning. And so certainly that is a component that needs to be strengthened in the future. It's also a result of the replication of structural inequities in response with cumulative and additive risks on certain populations who continually get hit over and over as new stressors appear in their lives. And finally, I would say that it is also a result of inadequate county department relationships and infrastructure to respond to community needs and predictable inequities. And this is not necessarily faulting the county or BCPH. This is really about an understanding of how we invest in public health and an understanding of how we work together and where we can make greater progress in really deepening those relationships, and building an infrastructure that does allow us to be much more responsive in the future, much more flexible, and is able to incorporate our lessons as well as our preparation for next time. So when we think about our public health response, there are a couple of things that I wanted to mention. One is we're really thinking about a rapid response, which leverages existing public health structures, teams, and relationships, and is work that we could undertake within as quickly as 2 months, but really centering on 6 to 18 months. And then we're also looking at longer term response work, which is requires a deeper shift of the agency towards priority work and would be implemented over a period of 1 to 5 years or more. We're also particularly interested in making sure that public health is focusing on its value add and unique contributions, things that other agencies can't do, aren't prepared to do. Those include particular roles in terms of data and surveillance, convening, supporting integrated planning that embeds a public health lens and is grounded in racial and health equity, and continuing to strengthen work in addressing root causes and structural inequities through policy and systems change, and also through community empowerment. When we look at the public health priorities that are emerging, we see 6 areas right now. We certainly need to continue to surveil, mitigate, and contain the virus in our community. We also have a particular value add in terms of vaccine equity, mental and behavioral health and trauma, child health and development, food insecurity, and recovering some of our regulatory responsibilities. In terms of surveillance, mitigation, and containment, some of our internal work includes developing out this pandemic response recovery plan, the pandemic response recovery plan that Chris Campbell has presented to you previously, and continued tracking of cases, especially variants, and externally to be able to link that work to outbreak response, shifting responsibilities out of public health. So there are some spaces where public health will be pulling back, including testing and general vaccination coordination, and that work really needs to be effectively transitioned over to our partners, including federally qualified health centers, as well as other healthcare providers. Additional external work includes communications and public messaging, which will continue to be a significant need in the agency and with the community, including making sure that messaging is produced not just bilingually, but in culturally responsive ways, and is provided on multiple platforms. And in terms of policies and guidance, making sure that we are attentive to guidance for schools returning in the fall, thinking about mandatory vaccinations following licensure, planning for a fall general community resurgence that is likely, criteria for enacting new public health orders in coordination with Denver Metro, local public health agencies, and CDPHE, so that we're working in unison. In terms of vaccine equity, our internal focus includes collaboration and joint planning with our community ambassadors, cultural brokers, and other partners, and externally continuing to provide equity clinics in Longmont, Boulder, and Lafayette with BCPA, Boulder Community Health Clinica, and outreach to support vaccination uptake, particularly with priority populations with children when younger kids become eligible, and for boosters. In terms of mental and behavioral health and trauma, we are looking at a rapid response that aims to embed, deepen work across programs. So we're taking our existing programs and really applying a mental and behavioral health lens to the work that's being done in those programs to really deepen that work. We're hoping that we will have some resources to add staff and to provide additional training to staff and to our partners, including mental health first aid, youth mental health first aid, and trauma-informed care. We are also continuing to convene a convening role in the Boulder County Mental Health Recovery Planning, which is the county-wide planning around this issue. And then longer term, we are hoping to develop and advance a primary prevention approach to addressing root causes of mental and behavioral health and trauma. And we know that Colorado was 48th in the country among states in mental and behavioral health prior to the pandemic. And our situation has worsened along with most states during the pandemic. So we really think that what's needed is not, some munching, some chewing around the edges, but really something that's a structural change that really puts an emphasis on strengthening positive mental health, addressing culture shifts, really making sure that our systems are structurally improved, that we have better continuums of care and integration across agencies, and also that we are really advancing pro-mental health public and organizational policies. In the space of child health and development, we know that a number of children and families were impacted by the difficulties of a lot of closures and lack of social opportunities, and we're really interested in seeing how we can move to support those groups better, including not just school districts, but also early child care providers, expanding our programs to include informal daycare providers, which we haven't previously been able to work with, making sure that our staff and partners have additional training resources in this space, and making sure that our own BCPH resources and programs have a greater integration and are working together in a more seamless fashion. And then longer term, really interested in how can we accelerate the development of the Universal Home Visitation Program that's been under development for a while. And we are on the cusp of being able to make some great strides forward. We have an amazing group of community partners ranging from hospitals to our on-the-ground safety networks and home visitation programs that are all working together now, beginning to see what that unified vision is and are on board to participate. We're looking at having a planning grant that we're feeling pretty positive about very soon, which would allow us to move into that space. And this would be a national caliber program that we would be working with national leaders and international leaders in this space to really implement a first-class initiative. Food insecurity is a little bit simpler. Our rapid response is really to increase pass-through funds to support families, especially those that are ineligible for federal support, including folks who are undocumented or who fall in some of the federal eligibility gaps. And in terms of infrastructure, looking at instituting a program to provide clients with rechargeable cards, which would simplify their access to benefits greatly. In terms of support to restaurants to reopen safely, we're looking at increased staff to meet that need. Last year, much of our food safety inspection team was really deployed on COVID, and so we are quite far behind on our inspections. So we're hoping to boost that staffing a little bit, and also to add a Chinese oral cultural specialist, which we no longer have, and which has actually been awarded a national award for innovation in best practices, and we hope to have that position in place soon. In terms of policy and systems change, I'm not going to go through all of this, but this is a space where BCPH has a terrific track record and has done some fantastic work over the past few years. And what we really want to do is we want to take that experience and really see how we can apply that strategy across BCPH's work, particularly including a focus on recovery priorities, and to have some dedicated staff who can do this work. We have not been able to do that previously. We have kind of had to piecemeal initiatives together, but we'd like a more intentional, focused approach to how do we really use policy and systems change to get at root causes, to advance prevention, in some of these priority areas. Same about community engagement. It's a strategy that we have used. We have great experience in community engagement in BCPH, but what we don't have is dedicated staff and particular strategic approaches to how we embed community engagement across our agency's work, so that we're really being comprehensive and efficient, and also finding ways that we can learn and work together and really connect with our partners so that we are building much deeper relationships in the community, particularly with community-based organizations who really have a much stronger feel for what the needs on the ground are and the kinds of interventions that'll be successful, and really working hand in hand with those partners much more. In terms of a timeline, we're looking at July and August. You guys may remember from the previous 3-phase approach. We're doing some pre-planning and getting some clarity on investment resources right now, including looking forward to hearing from the county commissioners on a request for some of the ARPA funds. September and October will be include a focus on implementation of our rapid response actions, and September to February are some of that longer, deeper plan for the agency with partners on longer term recovery planning. We'll stop there, and I am happy to take any questions.
I'll jump in with some questions. Thanks, Lexi, for going through that. And I'm pleased to see all of the commitment to that sort of community engagement piece and the policy and structural lens to looking at changes. I mean, I was struck by, I think Commissioner Loachman did a guest piece in the Daily Camera several months ago about, things that we learned coming out of the flood that we didn't necessarily apply when we were addressing the pandemic recovery. So I'm just want to ensure that, we're doing all that we can to make sure that the next time we have some sort of event, whether or not it's a flood or a fire or a pandemic, God, I hope not, just that we have really deepened those community relationships with the communities we know are going to be at highest risk. And so I'm glad to see that be really a part of this next step. And I just want to, again, voice my support for that engagement with the organizations that are on the ground that have been working in community for a long time, and how can we really lean on those relationships and strengthen those so that we're in a better position the next time we need to respond. So that was it, just my sort of follow-up thoughts on that reflection.
Thank you, Mark.
Yeah, it's certainly a pretty huge undertaking looking at all those, and it'll be interesting to see how some of the funding requests shape up for that. But I mean, I think regardless, it's going to go on anyway. So I really like the way you've kind of thought about that in terms of those rapid response actions and then the longer term planning. So again, yeah, a lot of hard work ahead.
One additional question for me, just on because there was some national coverage of Colorado's youth mental health challenges. Do we know anything about Boulder County youth in particular? I mean, I know historically we had higher rates of depression and suicide attempts, and so I don't know if that is still the case in Boulder County, but how we are faring coming through the pandemic and going forward.
We did see increases in most of our data points. Like most places, it wasn't as bad as in some places, but it's definitely a concern that we have, because we know that just because the number of cases is subsiding and going down a little bit, that doesn't automatically overnight translate into better mental health for everybody. These are going to be lasting effects. And the fact that prior to the pandemic, our statistics were already low brings us additional concern. And Boulder County Public Health had named, I think you remember, Morgan, we had named mental health our priority. And then the pandemic hit. And so we really didn't have the opportunity to build out our infrastructure for really making that priority embedded across our agency, developing a strategic plan for how we do that work. What does it mean? And so this is really our moment and our opportunity to kind of go back and pick up some of that really critical work that was, approved by the board prior to the pandemic, and we were getting ready to go. And now we really need to go deep in this space. And we're really excited about some of the opportunities that we're seeing. Marcy Campbell's been doing a lot of work, a lot of conversations with folks in the community, with the school districts to not just continue the work that we were doing previously, but to really help build out kind of what that countywide vision for mental health work is, so that public health can really slip into this space of, where is our value add? Where is it that we can really move the needle, make a difference? And we see moving into some of the primary prevention work as a real opportunity. And that's a conversation that our Metro Denver public health partners have been really interested in advancing together, is how do we develop a regional strategy for primary prevention that can really take us into a much deeper place. And there's some challenges structurally in terms of things like CDPHE doesn't have a mental health team that, we'll continue to bring up and hope that they can, find the resources and the skill to kind of really convene that kind of work. But regardless, we're going to move forward in this space because it's critical for our kids, for the youth, for getting all of us back on track and getting us to a better spot.
Great, thank you. And that, I know that you mentioned the strategic planning process has to go again next year. That's mandated by the state, right? That we have to do this every 3 years. And is there a way to roll up, some of the work that we had started and then got interrupted?
So Kelly Hinch and her team are going to be leading a lot of that work. And what we're thinking about is really using this fall period as an opportunity to do some bridge thinking, some thinking about how do we bridge what needs to be done quickly now in preparation for that broader strategic planning process. So we're really trying to make it an integrated process without getting too far ahead of ourselves. There will also be a community health assessment in between those two processes. So there is a whole kind of complex sequence of planning that's going to be happening over the next year and a half.
Great, thanks, Lexi.
Well, thanks, Lexi. We'll look forward to getting updates along the way, and excited to see this work will be kicking off.
Great,
all right.
Thanks very much, everybody.
Item number 5, pandemic updates.
Yeah, this is Indira Gujral. I'm the division manager for communicable disease and emergency management. So I'm going to kick us off with kind of the cases and hospitalizations, and then Chris Campbell is going to talk about vaccination efforts and all of the equity and great work we're doing. So, all right. Let's see. Can you see those slides, Greg?
That's good.
Thank you. So the first thing I'm going to start off is just some state. Colorado has released some COVID, data key messages that they've shared that I think are really important. Across the state, we've seen hospitalizations continue to decline statewide, and as you might remember, the hospitalization rate is what the state is using to kind of assess how things are going with our old dial metrics. But they are declining, and the reproductive number has dropped down to 0.77, which indicates, decreasing transmission. And we often see this in the summer months. And approximately, it's estimated that 1 in every 390 people are currently infectious, and 54% of the population is believed to be immune to COVID as of last week. The Delta variant continues to be a concern. We estimate that 90% of the cases that we're seeing now are due to the Delta variant. It is more infectious, and vaccines definitely provide coverage, but at a lower protection rate than they did for, say, the Alpha variant. And so our interventions to promote vaccinations are really important right now, because this not only reduces the severe COVID cases that we see in hospital demand, but this will become even more important as we enter into the fall and winter months, in which we see that seasonal effect of accelerated transmission due to more time indoors, and then also other viruses that emerge, such as the influenza. And vaccines matter. So this was shared with me today that out of during the week of June 27th to July 3rd, out of the 161 people that were admitted to the hospital with a confirmed case of COVID, 144 of those people, so almost 90%, were not known to have received any vaccine before their hospitalization. So this really kind of hits home the importance of those vaccines in preventing hospitalizations and death. In terms of our testing numbers, we have about 627 Boulder County residents that are performing tests each week, and our test 7-day positivity is at 2%. It's up slightly, but this can fluctuate over time just based on how many people are receiving those tests. But we still monitor and track them. It's looking good. In terms of our hospitalizations and deaths among residents, we have around 13. This is a 7-day rolling average of cases. So we're about 13 cases a day for over the past week. That's up slightly from about 9 from the previous week, but we're still holding fairly low rates of cases that we're identifying. And then the case trends among age groups, we are seeing, the majority of cases last week were in that 23 to 34-year-old age group. I think we had 19 of them. That was the highest number of cases in that age group, followed by the 35 to 44-year-olds. So we had about 14 cases, and then followed by the 18 to 22-year-olds. So when Chris talks about vaccinations, you can see that those cases that we're seeing, the majority of those cases are coming from those age groups, and they're also tend to be the group that we need to do more promotion of vaccines with as well. In the 0 to 9, I think we just had 1 or 2 cases in the past week. So we're doing okay, but we definitely have a targeted population that we need to focus on. And this is a cumulative look at all the cases, hospitalizations, and deaths by race and ethnicity. And we see very similar trends that we have throughout the whole pandemic, where for the most part, the cases and hospitalizations are, hold on one second. Cases and hospitalizations we've seen strong disparities. I'm going to ask for 1 second so I can turn off that phone. Hold on. All right, sorry about that. Okay. In terms of the case numbers, they are rising slightly and disparities still exist. So this is looking at just the race and ethnicity, proportion of cases by race and ethnicity by each week. And, white non-Hispanics represent 77% of the population. And this past week, they represent 63% of the cases. Among our Hispanic Latinx population, they represented 17% of the cases last week, and they represent 14% of the population. And then what we saw in this last week was, of course, this any other race, non-Hispanic, where it seems to be a doubling. So we're not sure what's going on that, but these have been consistent trends over time. And I do think that the disparities still exist, but they are starting to mirror that of the population percentages in Boulder County. Last week also, or over time, you can see here the percentage of cases in Boulder, Longmont, Lafayette, Louisville, Superior, and other municipalities, including unincorporated Boulder County. And within the last week, we're seeing similar percentages of cases in Boulder and Longmont. In terms of our hospitalizations, the hospitalizations have slightly increased over this past week. I think we have a total of 11 in the last week. That was up from 9. And you can see we are in the red line there, Boulder County, and that compared to the Denver metro region, we are still below the Denver metro region in terms of the 14-day average admission rate over time, and that we are mirroring very similar to what their trends are as well. And deaths remain low in the second quarter of 2021. We have had 5 deaths in the past since May, and brings us to a total of 261 deaths in Boulder County, and 67% of all of our deaths are attributed to residing in a long-term care facility. Some information that we received from the state on vaccine breakthrough cases. So these are individuals who have been vaccinated and are 2 weeks post their completed dosage of vaccine. And in Boulder County, we've had 198 vaccine breakthrough cases, 7 hospitalizations and 1 death. And I know that seems like a lot, but when you consider that over 250,000 people have been vaccinated, it's actually quite small. So we are feeling very confident that these vaccines are definitely supporting our COVID initiative to stop COVID. The school guidance is been just released. So the CDC just released it, I believe, last Friday, and their K-12 guidance. We're still waiting for the state to release their guidance. And right now we have a team of epidemiologists, including Dr. Urbina, and a K-12 liaison, and we are all reviewing the guidance and making recommendations for BCPH leadership. And we are always working in continuous collaboration with our K-12 partners, and that includes both large school districts plus our independent schools as well, private schools. And then if anyone is interested in more data resources, this is all the different spaces that you can go to get more data. So I'll stop there and see if there's any questions. I know there was a question from a guest maybe on schools. So I don't know if now is a good time, or if you would like for Chris to do his vaccination presentation first, Greg, and then have him.
I think since you just ended with the school guidance, might be proper time to take this question right now. So Mr. Johnson, if you'd like to introduce yourself, and then do we need address for this or not?
I can give my address.
That would be helpful, yes.
Sure.
Okay.
So, yeah. And, I have more of a statement. I wanted to just kind of, to reference this. I mean, I think you guys are a little bit informal here. I don't want to just kind of ramble on, but I did get a lot of things down, wrote a lot of thoughts down that I kind of want to get through on this. My name is Sam Johnson. I'm at 1660 Snowy Owl in Broomfield, which is in the BVSD school district. I'm the parent of a fourth grader, about to be a fourth grader. And I'd just like to start by thanking everybody here for the efforts that have been made this past year. I think we've done better than a lot of places. I do appreciate all your work. I know that it must have been very stressful navigating the situation. I do want to give a little bit of my background because I feel like there is a lot of, uninformed opinions being thrown around these days. And I'm afraid that, if I don't, you just kind of assume that I'm coming from a place of ignorance. I'm definitely not going to claim to be a scientist or a doctor. I'm an engineer. But I do have a couple of degrees from MIT. Not that means that I'm not ignorant, but that education did give me the tools to read and critically digest a ton of information from the sources. And I can still figure out most of the words that even at my age. More pertinently, prior to the pandemic, I worked to develop a supply chain risk program for Seagate. And part of that was analyzing the pandemic plans of hundreds of our suppliers and pushing them to improve. So I am pretty familiar with the worldwide best practices for pandemic mitigation, at least for manufacturing. And it's been frustrating this year that our country has had such a hard time with just the basic stuff. Number one, airborne diseases require masking. So I'm afraid I do have to kind of express my disappointment with, kind of the published changes, recent changes in the masking policy for indoor schooling. I do understand that there is an argument that the transmission rates in our schools have been low, especially in elementary schools. However, almost all the studies I have seen credit this to the good safety protocols that we had, and masking in particular. The hypothesis that kids don't have the lung power to project virus far into the air seems dubious at best to me, at least for anyone that's ever been around a bunch of screaming kids. And we know it's aerosol now. So, and then, we did just reference this, but the CDC did release their guidelines on Friday, updated guidelines. One of the top bullets there says, masks should be worn indoors by all individuals ages 2 and older who are not fully vaccinated. And we know under 12 is not vaccinated. Consistent and correct mask use by people who are not fully vaccinated is especially important indoors and in crowded settings. So, another factor I've also heard is that detected community rates in Boulder are relatively low, at least for now. I think we also are anticipating a fall surge. But even with the approximate current infected rate of even as low as 1 in 1,000, I come up with a very small chance, well under 10%, that any given elementary school is going to make it to Christmas without having a case in the classroom. So the question is, will that case cause an outbreak in a completely unvaccinated and vulnerable population of kids? Or will our protocols stop the infection right there? If that child is maskless with Delta sitting in a small classroom, I think the outbreak odds are pretty high. And since Delta reportedly is not only more dangerous, but also twice as infectious, if we drop masks now, I believe the risk to our kids will be higher than ever. My own personal standard this year for making decisions for my son has been, I'm not going to put him into any position that I wouldn't want to be in. And I think very few people in this meeting will want to sit in a packed room full of unvaccinated, unmasked people all day, every day for months, especially without a vaccine for ourselves, no matter how healthy we are. I have heard also that there might be a testing program in schools. However, if testing is voluntary, it's not going to be much better than sentinel testing, not a preventative measure. So sure, my son will probably raise his hand for it if it's available, but why does he need to be the canary in the coal mine? I understand that Boulder Health is still strongly encouraging the continued use of masks, but my son shouldn't have to be the role model for masking and have to deal with all that negative peer pressure. We're pushing the line that unvaccinated people should still continue wearing masks in the grocery store. That strategy down to the schools now. But even after we all saw that advice was immediately ignored by those who needed to follow it. So is the objective here to recreate what has happened all over our country in our elementary schools as well, with boys name calling and bullying each other for continuing to wear masks?
Sir, your time is up. I'm sorry, your time is up, but you can finish your thought. Thank you.
All right, so schools should be safe places for learning. I'm begging you to reconsider these changes, at least until our kids have the opportunity to be vaccinated. Thanks for your time.
Thank you, Sam.
Thank you.
Thanks for that that input, and I share your concerns as a parent of 2 unvaccinated elementary school children, also in BBSD. And I guess I don't know. I thought that BBSD makes that policy call under recommendation from Boulder County Public Health. Can you just clarify that, Indira?
Yeah, I think there's, I'm getting a little feedback. I think there's 2 ways we can go. One is that Boulder County Public Health can make a recommendation to the school districts and to independent private schools to continue masking, particularly for those who are unable to get vaccinated, particularly in that younger than 12 age group. And I do believe there's also a legal recourse also if we wanted to do a public health order specific to schools or specific agencies. And I would ask Trina to kind of weigh in on that, but that is another option. I think the masking debate has been really politically challenging on both sides. And so I think those are things that we just have to consider and weigh in and try to collaborate the best we can with our partners to come up with the best solution. I am hopeful that the vaccines for children under the age of 12 will be coming out. in the next few months, a lot earlier than we thought. So that is also going to be very hopeful for everyone. I don't know, Trina or Kate, if you want to share about what potential options there are on the table.
Yeah, I can jump in on that. The board can issue an order to schools. I'll just note that our previous mask orders and the state's previous mask orders never covered under the age of 12. That was a policy implemented by BVSD and St. Vrain, which they are still welcome to do. The other thing I'll note is that the CDC does have an order in effect that all individuals age 2 and over must wear a mask on public transportation. And that does include school buses. And that is a requirement from the federal government. And that applies to all public and private schools who are transporting children to and from school.
Yeah, so what Trina is suggesting is that even, regardless of what we do, there will still be a mask requirement for any child taking a bus to school.
I'll also just add that Boulder County Public Health continues to strongly recommend masking for anyone who is unvaccinated, and we are working with our school partners to make sure that they have the resources that they need to be able to effectively follow those recommendations. My understanding is that BVSD does plan to follow strong recommendations. What that will look like specifically, we'll have to see. I'm particularly sensitive to your comment that children who are following guidelines are being bullied and are subject to that, and I'm very concerned about that. I think that is something that we probably do need to pay attention to. It's not the first time that I've heard it, and it doesn't set the right tone in the schools. So thank you for that.
And Sam, I must apologize, but our bylaws and you have 3 minutes to give a public comment, so we really can't have a back and forth discussion on this. Sorry about that.
Greg,
Okay.
Greg,
Well, I guess we will be hearing more about this in the lead up to the start of school here at the beginning to middle part of August.
Greg,
yeah.
I think Dr. Urbina had a comment too.
Okay, Dr. Urbina, go ahead.
Greg, thank you very much. I just wanted to say thanks, Sam, for showing up. We spend a lot of time listening to concerned parents like yourself. I appreciate the fact that you have read the science and you're a scientist. I think we often struggle with parents and teachers and administrators and community members that don't spend the time. They've made an opinion. They don't spend the time looking for information. So I wanted to thank you for coming, and we heard you loud and clear, and we're going to try our best to try to follow the guidelines as well as make our kids as safe as we can in our school systems so they can continue to learn. So thank you.
Thank you. I appreciate that.
Okay, I think Chris will move on to the vaccination update.
Thank you, everyone. Good evening. My name is Chris Campbell. I'm the emergency manager with Boulder County Public Health. Just a real brief update on the vaccination campaign, and let me jump right into that for the board. Okay. Let's see if you all can let me know if you're able to see that. That'd be helpful. Looks good. Okay, thank you. Appreciate it. Always that awkward moment where you hope your presentation comes up the right way. So just to jump right into it, just wanted to frame the conversation about where we're at with the vaccination campaign. Certainly I always think back in the updates we've given to the board and the community, and it's definitely remarkable to see where we're at in this campaign. So, over 226,000 community members, ages 12 plus. So these are eligible community members who've been vaccinated. About 78% of the population with one dose, and remarkably, again, that number for community members with that full course, which was where we want to be, at 72%. I do want to talk about some areas we're looking at for the board and just making sure we study and look at One data point we're going to start sharing is, it's showing the full adult population, the full population in the county, sorry, to kind of compare that contrast and kind of that goal we have, looking ahead to younger community members getting vaccinated, just to show where we're at and also show the community that we will have some work to do. The community's been remarkable in going out and getting vaccinated. And so we'll be sharing that data point with the community and the board coming up, just to show where those percentages drop a little bit as we add, all of the residents and community members in Boulder County. So just wanted to highlight that for the board. As Indira mentioned, certainly some remarkable, progress and some work to do in the age groups. If you see the 70 plus, that's at 99% of community members, 70 plus, with at least one course of vaccine, which is great to see. Indira did mention, we are very focused now on the younger community members, 20 to 29, that 12 to 19 age group. So a lot of the strategies we're discussing and I'll share with you focus on those age groups. Another point, I think, and it's a good to, again, kind of shift and reframe and set expectations with the community members and with the board. At one point, we were doing nearly 4,000 vaccines a day. So we have very much shifted out of that mass vaccination campaign as a community, and numbers have really dropped. So averaging about 312 per day, vaccines per day, which is low. So as we talk to providers, our public health staff, we're doing a clinic 3 days a week now, evening hours on Saturdays. Even if we see 30, 40 community members, that's success. And we're at that stage now where we've kind of reframed our expectations and doing that really hard work of connecting with community members. And I'll talk a little bit about that. Just want to reiterate the importance of getting vaccinated. Certainly we see some impacts of seasonal and kind of impacts there, but what we do know is in both case rates and also hospitalizations, the communities and counties that have a higher uptake of vaccine, we are definitely seeing lower hospitalizations and we're seeing lower case rates, and that is a correlation that rings true. So again, for community members listening, for the board, together we want to continue to get that message out there. Vaccines are easily accessible now. The vast majority of providers out there, you don't even need an appointment. You can just walk in. We have shifted, many of the providers have shifted to evening hours, as I mentioned, removing those barriers. So, it's definitely time to consider getting vaccinated. Want to shift gears a little bit, and I'm not going to dig too much in this data. I just want to recognize, that we still have work to do with our BIPOC community members. We track very closely data in a number of different areas. This shows, again, some of the age groups that we need to continue to work at that mirrors the data I showed. I'm going to reframe or refresh the group on our vaccine strategies, our equity strategies, and talk about some of the shifts we made and where we're at. Just know that, and I want the community to know, we have a GIS dashboard, a vaccine data dashboard. We're digging into the data down to the community level and really trying to connect with community members, share information with them, and really talk through questions they have so they can make that decision to get vaccinated. You've seen this slide before. It's real busy and some things have shifted here, but the essence of our strategy has not shifted. We still continue to focus on, first and foremost, vaccine confidence, vaccine education. So town halls continue. We do town halls in English and Spanish. Dr. Bina still continues to help out. Elizabeth Mendoza continues to work with us as a cultural broker to provide information, to answer questions. So that does continue. As part of this confidence as well, our community ambassador group, who are part of our vaccine equity coordination group, they continued really to do canvassing, to share their stories, to have community members that have been vaccinated share their story and talk about their experience with getting vaccinated, why it is important for them, for their family, not only for themselves, for their family, and for their community. So that work continues, and we have laid out that strategy early on, and really have stuck to that strategy and have seen success. Again, I mentioned our Vaccine Equity Coordinating Committee. So this group, this is that grassroots group that really informed our clinics and our strategy and continues to do so. They continue to work with us and discuss shifts where we need to focus. We really are listening to community members and really trying to, get that information out there, shift our clinics, bring them into places that are easily accessible. So that kind of also goes into our vaccine connection. Again, connecting community members with vaccines. And I'll talk a little more about that, but that strategy continues. We really have moved out of that, the mass vaccination phase. That was more the vaccine distribution. We're really focused with, you've heard me say many times, working with our provider, a larger provider network. Boulder Community Health, for example, has stopped doing their regular clinic. You can certainly still get vaccinated there, but they did have a mass vaccination clinic, and that now is no longer available. But so things have shifted out of that mass vaccination campaign. The distribution really is smaller clinics. Next slide here. So just over the next several weeks to let the board know, so that focus on education and confidence. So our community ambassadors, as I mentioned, cultural brokers are doing canvassing, door to door, working with staff at the city of Longmont, for example, to provide food assistance for communities. And they're helping us share information. So this is word of mouth as well. And I mentioned how community members are sharing their story about getting vaccinated and, encouraging their fellow community members to get vaccinated. I also mentioned the Vaccine Equity Coordinating Committee. They continue to lead those efforts. Talked a lot about these things. One area I do want to talk about, particularly with our federally qualified health centers, Clinica and Salud, they are really focused on any community member that comes in for any type of primary care, even dentistry, they're asking them about vaccines. And so it's a motivational interviewing approach, and they are really trying to answer questions, understand where the person is coming from, understand if they need information where they can go get that, and they're actually vaccinating them right then on site, which is amazing. And so that's the shift that we're really looking at together with our partners. Just do want to mention the State Health Department, CDPHE, has put a bunch of resources into clinics. So they have buses, they have bigger buses, they have smaller buses. They've really shifted because they've closed the larger community vaccination sites. Those are starting to close. And so resources for businesses, we're leveraging those. So across the county, even at the peak to peak, Netherland area, Ward, those areas, we're looking to have vaccination clinics that are supported by the State Health Department, events throughout Longmont and Lafayette. Those are all continuing, and we're really supporting community members. It's really driven both at a grassroots level, a business level, events. So we're leveraging all those resources. We also continue to have those clinics that we're having with Boulder County Public Health and Longmont, the San Bernardino Valley Hub. We've shifted these. They're in the evening. They're easy to get to. No appointments necessary. You can set up an appointment. No cost at all. Just show up and get vaccinated. So we have shifted there. I did mention how vaccines are widely available. So just want to remind the community members of that and the board. And we are looking ahead. So some of the strategies we're looking at is anticipating the younger community members being approved to get vaccinated. So we're going to work with providers, early childhood providers, schools, vaccine providers, and primary care providers to really ensure we're ready to go and work towards that goal of getting adolescents vaccinated. And just wanted Angela Simmental is on. I just want to call out her team and thank them. They continue to work from a public information perspective. We continue to refine this and work on this, but certainly have an educational campaign out there via social media and websites. Our community ambassadors have flyers they hand out and additional information to provide that education to community members. Additionally, we do have a survey out there and are working with Taylor Carranza and others, staff, to really understand from family and adolescents, what their questions are. So that really is going to inform an educational campaign as we look ahead, focus on that, not only the 12 to 16-year-old age group, but even younger community members. So that would be the end of my update. I was trying to go fast, and we don't have, we meet with the board not too often, so always have real robust updates for y'all, but happy to answer questions if there's any.
If there's no questions, I just want to highlight that Chris and his team and Keith Rawls and his team and the immunization program have just been doing an outstanding job. And these rates were accomplished because of all the coordination and hard work with our partners. We're really grateful for everybody sticking it in with that 6-month campaign. It was pretty big. So kudos to Chris. I also wanted to share something Chris shared, which is that we are going to start meeting with our healthcare partners in the pediatric and family practice realms to start preparing them for when the vaccines are to arrive for vaccine, to be able to provide vaccinations under the age of 12. Vaccinating that population is very different than vaccinating an adult population or even the youth population. And so it's going to require us to strategically move in a slightly different direction with our partners. And then lastly, I know that as part of our pandemic response, I just wanted to offer for Trina to jump in here and kind of share what's happening with all the orders, because I think there was some confusion last week with the governor's announcement. So Trina, thank you.
Thanks, Indira. I'm just going to give a brief summary of the legal lay of the land at the moment. If you'll all recall, we're in level clear in Boulder County, which means no restrictions beyond what the state has in place, which is a little confusing based on last week's media announcements. Contrary to kind of what people took away from the media, the disaster declaration at the state level is actually still in effect. What the governor did was he consolidated all of his executive orders into one executive order. So everything concerning the criminal justice statutes and unemployment and eligibility for Medicaid and delivery of emergency goods, all of that stuff just got put into one executive order, which is now about 15 pages long, and buried down on page 11 or so, it does still say there's a disaster declaration in effect. So I just wanted to clear that up. The CDPHE orders are also still in effect, and I think it's important to note that those are actually independent of the governor's orders. CDPHE can issue orders separate from whether or not there's a disaster declaration in effect and separate from what the governor is ordering. So on the state level, face coverings are still required in jails and in other healthcare settings for those that are unvaccinated. There is still Public Health Order 2020, which concerns skilled nursing, long-term care facilities, assisted living. That's pretty complicated. I won't go into it. There's also still a CDPH order about laboratory data reporting and vaccine access and data reporting. So those are all still in effect. They are going to be in effect, I don't know how long, but really not much has changed since the governor's announcement last week. And I'm happy to answer any questions about that.
Okay, seeing no questions, thank you for giving us the time to provide this pandemic update response update.
All right, well, thank you. Always, it's interesting as we move further along. Chris, do we have a sense from interviews with, let's say, the 20 to 40 crowd of, is the reason for not vaccinating all over the map, or does it have a general theme of, well, I'm young, I'm healthy, and I thought I heard early on that my age group wasn't at high risk of hospitalization or death. So I'm just curious if general themes are present there.
Thanks, Greg. I'm seeing Indira popping on, maybe Lexi. For me, it is a bit all over the map, to be honest. I think that's why we're digging in that motivational interviewing and providing as much information as possible. It seems like, folks have unique situations. I do think there's part of that of, which is why we want to share the data maybe of, even though we do have a tremendous uptake in vaccination rate in Boulder County, we have work to do. And, it's crucial now to continue and still get vaccinated. With the disease still prevalent, we're seeing some uptakes and looking towards the fall, some upticks. We want to continue to share that information with that age group. But it does feel like it just kind of varies. So I don't know, Indira, if you had thoughts there. I know you popped on. I don't have the greatest answers there.
Yeah, I mean, I think that there are people who are hesitant, who have questions, who have concerns that need to be addressed more on that one-to-one. We know that they trust their providers and they're considered the most trusted source. So we are definitely working with our providers to take the time to have those conversations. And then there's also access issues. So a lot of our vaccine clinics that we offered for the first 5 months through May were during the day. And some people they don't get paid time off. They don't have the ability to get time off during the day. So as you can see from Chris's presentation, we, in collaboration with a lot of our enrolled providers in the community, have really shifted to nights, weekends, and believe it or not, and you can believe it, it costs money to shift to nights and weekends. You're paying for extra security, you're paying for extra staff. So, but we're making that commitment because we feel it's the right thing to do. And, truly, it probably sets a precedence for future equity work. Needs to probably pivot to more nights and weekends so that way we can reach the populations that are in need of these services the most. So that's probably been the biggest pivot, and we are still seeing those increases, which is great. But we do rely heavily on our provider counterparts to have those one-on-one conversations. And we're actually going to be providing a motivational interviewing training to healthcare providers to help them to refresh them and remind them on how to have that conversation about getting people to choose a COVID vaccine.
Thank you both for that response. It'll also be interesting to see. It probably won't play out so much in the summer, but we are seeing like bits and pieces now of increasing rates, right? Increasing numbers of cases from a week or two prior. And, unfortunately, it is largely preventable. So I'm not sure how much longer it would take for that message to get through. But hopefully it doesn't get worse in the fall, which we probably all understand it likely will.
Yeah, I think we do have a window of time to just keep pushing at it. I think one thing that's really positive is the university. Their policy for students to get vaccinated is going to have a huge positive impact on our community. We had a lot of challenges last year, as you recall. So hopefully we will not be seeing those challenges this fall. And we're really hopeful that we can try to meet some of these goals by the fall, early winter before, we are expecting a bad flu season. We are expecting other viruses to emerge. So, and that can be, the combination between COVID and another virus can be really, it can be really challenging, particularly for individuals with any type of immunocompromised system.
There are also opportunities as the vaccine becomes licensed, and as that new population of eligible kids comes online. Those are moments for us to really seize the opportunity to, go deep again, to do an extra push. There is a question on the table about whether healthcare provider institutions, whether they're hospitals or long-term care facilities or PH, will require a vaccine among staff once it becomes licensed. That is something that not only increase confidence in folks, but also to, get some of our maybe a little bit hesitant providers themselves a little bit more information as they learn about what's being required and what the science is and what's behind the work. So I think that those opportunities also gives us new pathways into hesitant populations.
Kelly, did you have a question?
I don't have a question. I just have a comment. So this is Kelly Hinch, Interim Strategic Initiatives Director. I just wanted to reiterate something that Indira and Chris are saying about reaching out to these disproportionate and impacted populations, in that this is just a personal anecdote, but half my family is Latinx and some of them work, and this is in another state. However, they didn't have the ability to, their employers didn't give them opportunities to go out and get the vaccine. And so some work was done with the employers around the importance of getting their employees vaccinated and how that would impact them positively on the bottom end, because they're not going to have employees missing work. So it wasn't that their heart was in it, oh yeah, they need it, but it was around the bottom line piece. It sounds pretty rough for public health to say and things like that, but I think that's really a reality that we need to look at, and what motivates people to be supportive to uptake vaccines.
Okay, well, great update. Thank you, everybody, for your hard work, and we look forward to continued updates and continued declines. All right, we are on to item 6, which is the director's report. Camille, I don't know if you want to take the opportunity to point out any highlights. I've read the report. I really don't have any questions. I noticed a slightly different format. I like the kind of call outs at the top of it. So yeah, if you have anything to bring up, feel free.
Thank you, Greg, and to the rest of the members. I don't have anything specific to highlight. I think it's a super thorough report, and you can tell that so much work is being done above and beyond, obviously, the response and recovery work that was highlighted tonight. I do want to just highlight a couple of things. We talked about this briefly, but Vice President Santiago and their term is almost up. And I wanted you to know, Greg, that the county is going to be advertising, if they haven't already, for the vacancy to be filled. And then once those responses are reviewed by me, I will provide you, Greg, with a recommendation. And then ultimately the next step after that, of course, is that the commissioners decide on the applicant that gets that vacant spot. So I just wanted to let you know that we're actively taking care of that and following the existing path to it. It looks like, I'll pause. It looks like Morgan has a question. Yes.
I do. I thought I'd just actually raise my hand. Thanks, Camille, for that update. I did want to know, so it sounds like it's an open call for applicants to replace Jorge. They're not going from an existing pool of applicants. And then I would just say to all of us who are on here, please go out there and recruit. And particularly Jorge has brought a really important voice from the immigrant community. So I would love to see that voice continue to be represented on the board, and if that's possible, or, he's also our only Latinx member of the board. So really important, I think, for us to replace that voice and perspective in some way. So if we could all do our best to try to reach out into our community networks to encourage applicants. And then I am putting forth my desire for that reflection to those of you who are going to be reviewing the applicants. So thank you.
Thank you.
Good points, and definitely something we need to kind of keep at the forefront of our minds and our decisions. In terms of who we're replacing and what sector of the population they represent.
Definitely. Thank you, Morgan, and thank you, Greg. The only other thing that I wanted to add, and Greg, you made mention of, you liked the format of the director's report, and a couple of small changes we've made. Actually, in my meetings with the director's team and management team, I've been having more and more conversations about how to bring this report to life for the Board of Health. And you know, it is so very thorough, so full of information, but we're considering perhaps during these times of strategic planning and transition, and as well the information that Lexi, for example, highlighted, those priority areas where we're going to be taking a look at how do we bridge strategic plan to the next step in our phase of operations, because in some points of our operations, COVID has forever changed perhaps how we manage the work. Some teams have doubled and quadrupled, and that may not change how we approach the community, and how much we've leaned on our community partners during a pandemic is very key to us. Board members brought up, yeah, this has been an amazing opportunity for us to liaise. And yes, we've leaned on our community so much. How do we keep them engaged and keep them ready to roll up their sleeves with us to continue to do the work? And so we're considering finding ways to highlight a program or something innovative each month for you. We'll keep it brief perhaps, but just to bring it to life, and so that we could even forecast to you some of what we're planning to do, so that you can also have input. So if any of the directors or others who have had these conversations with me want to add a bit, please feel free. But, you know, we're just very excited to show you, to bring to life, to put evidence behind what we're saying, like here is where it really works, or here's where we had to shift and why. And that will also help you in making your decisions about the budget, or in asking questions, or in all that you do to liaise with your constituents in the community, especially when they're asking you questions about what is going on at Boulder County Public Health to address equity and any of the disparities that we see in the community. So we're already doing it. We just want to find different ways to bring it to you so that you can have input when the time is right, and have a full understanding of why we might be shifting in certain ways. So that was really all I wanted to bring forward. I want to make sure I don't miss any comments that were very good. If I may, Greg, Morgan said, could we share a link on how to apply to the Board of Health? And I don't have that at my fingertips, but certainly we could share that with board members, so that you can share it with others that you might work to encourage to apply for that position. So we'll get that to you. That's all I have.
Okay, thank you. Morgan or Landry, any questions on director's report?
No, thanks for your reflections on it.
Okay.
Thank you.
All right. Well, then item 7 is old and new business. I don't know if anybody has any updates. Going once, going twice. Okay. Well, that brings us to item 8, adjournment. So thank you, everybody. Very productive meeting. Look forward to getting back somewhat in person. So it should be exciting. And we'll get to meet Camille in person. So if it doesn't happen before then, take care, stay safe, and have a great summer.
Bye,
Okay.
everyone.
Bye.